Hi, everyone. Welcome to the show. I'm Dr. Nicole, and I'm really excited to share today's episode with you. We're going to be talking about the role of occupational therapy in helping us understand behavior and better support our children. I've been working with OTs since I first started in my teaching career back over 25 years ago, and can honestly say that a great occupational therapist brings just an immeasurable amount of knowledge, skill, relationship to the table in terms of understanding and meeting kids' needs. Over the years, occupational therapy in the pediatric realm, at least, has become known not only for supporting development and skill acquisition for kids in their everyday life functioning, but also for supporting sensory processing and integration, which is key for so many kids. And now we're seeing another shift in some OTs working with kids, being at the forefront of helping change the paradigm around how we understand and support child behavior and adult-child relationships. And one of the OTs who's passionate about doing that is Maggie Byers, and I'm so happy to have her on the show today. Let me tell you a little bit about her. Maggie's an occupational therapist at Thriving Littles. She guides parents undergoing their own evolution by supporting the daily interactions outside and inside of those difficult moments with their kids. She is a mom of 4 sensitive and spirited kids, all under the age of 6. Boy, do I get that and feel that. And she's passionate about shifting the paradigm of the way that we view behavior. Maggie is a Korean adoptee and currently resides in Houston, Texas. She's been an OT for 12 years and has a wonderful Instagram account for parents and professionals. We'll share the details of that with you at the end. Welcome to the show, Maggie. It's so great to have you here.
Thank you so much, Dr. Nicole. I am so honored to be here and to speak with you. I'm such a fan of your work, so thank you.
Thank you. And we connected on Instagram and I was like, oh, I need to get to know her better. This stuff is so good. And particularly because you're an occupational therapist talking about this. And I love seeing this newer way of understanding behavior and nervous system regulation and parent-child interaction seeping into all of the different disciplines, right? And so yes. I just love that. I think let's frame our discussion around, for our listeners, around you starting by sharing your story about how you came to, number one, be in the field of occupational therapy in the first place, because I find most people have interesting stories about that, but then also what led to sort of this shift or this focus on the relational, the nervous system regulations. Just kind of share your story with us.
Yeah, so I actually got into OT. I was contemplating occupational therapy. I was contemplating nursing. I've always had this love and passion for understanding people and psychology and mental health. So that's really what got me into the field of OT. And I practiced for about 12 years in just adult rehabilitation, working with people with brain injuries and spinal cord injuries. So I had this nervous system understanding, this neuroscience background. And it wasn't until I had my kids, I think a lot of people can probably relate to this. Once we become mothers, there's this shift, there's this change that happens. And for me, it was my kids were holding up this mirror to the things that I needed to heal. And so I kind of went into this deep dive into my own childhood experiences, my own trauma from, my adoption and other things in my life that have happened, and started to make sense of all of those experiences and how it was affecting my ability to function in my daily life and to be the parent that I really wanted to be. And so I think, I was finding myself stuck in this vicious cycle of kind of yelling, doing these same patterns that seemed very familiar, but I couldn't put my finger on it, and then being stuck in this shame and guilt cycle. And so it wasn't really until I dove into my own reparenting work and understanding my own nervous system at a motherhood level that I really was able to give myself compassion and my children compassion. And once I dove into this work, I knew that I could not do anything else for the rest of my life. And I connected with Katie on Instagram at Thriving Littles, and we started working together, and it's been, wonderful.
I love what you said about how you had your own children and realized that they were mirrors for your own stuff. And
Yeah.
that's so powerful. And it's so true. Whether, somebody thinks that that's true or not, or whether it's ever occurred to them, it's so true. I have often said that being a parent, having children, is by far the most intensive and productive personal development work that we can do if we let it, right? Because you're right, they are mirrors for us. And so I'd love to have you share a little bit more of what you mean by that. Like, was there an aha moment, or was there something that happened for you where you were like, oh, actually, this is about me?
Yes. So I just, I was picking up on these patterns with my kids. I was picking up on these, I guess we call them triggers, in our field, where I was constantly becoming activated. It was constantly eliciting this visceral reaction in my body. Cognitively, I knew, okay, they're a kid. They can, they're going to not listen sometimes, but viscerally in my body, there was a reaction that was coming up that was resisting that. And so I was taking note of these patterns that I was noticing with my kids, the behaviors that were really starting to irritate me and activate me on a daily basis, and really getting curious about what that meant for me. What was this bringing up in me? And there was so much. It was bringing up so much in me. And before, I had no idea that my child's behavior had anything to do with me. And often, our kids' behavior and our kids' reactions and emotions are this portal. Our triggers are kind of this portal to understanding where we didn't have the space to have these emotions, where we didn't have the space, the safe space to express these very, very human reactions in our own childhood.
I love that. And, I think that level of awareness is so key. And it's really what's lacking. And it's not parents' fault, right?
Yeah.
I'm thinking about you, I'm thinking about me, similar, like I had 4 children in 6 years. You had 4 children in 6, like it's a lot.
Yes.
Right? It's just a lot. And I want to say to all the moms and dads listening, like whether you have 1 or 10 or like whatever, like it's a lot, the day-to-day of it. And most of us have not received any sort of like information or training or support around our own experience of our kids' stuff. And so it's like our kids start doing things, and this applies to all kids, whether they're diagnosed with challenges or not, right? Like this is all kids. They start doing things. And so much when kids start doing things, whether it's tantruming or talking back or, refusing to go to bed at night or whatever it is, traditionally the focus has been on the child, right? What's wrong with the kid? This is a kid issue. Like we need to get the kid to do something. And what you're talking about here and what we're really shifting to in all of our fields, whether it's, psychology, occupational therapy, speech therapy, like whatever, is shifting towards this understanding that when kids are behaving in a certain way, when they're acting out, when they're doing these things, that's like an indication of things in the system that are probably problematic, right? Like, yes, sometimes there are specific things we need to address and deal with on the kid's side of the equation, but the kid is not the entire equation, right? And I think that's such a big shift in the field of working with children in general over the last several years, really from viewing it as this problem is in the child, and this is something that needs to be fixed or made different for the kid, and recognizing that, oh, the kid is just one piece of this picture.
Absolutely. Yes. I think for so long we've been in this behaviorist kind of paradigm where we see a behavior, shut it down. We see a behavior not comfortable for me, shut it down. And now we're really shifting to this, understanding the brain and body science, understanding that the behavior is really just the tip of the iceberg. And it's really just the communication of what's going on internally inside the child and inside for us. When we can understand our own behavior and how our reactions to our children come up, we can understand theirs as well.
Yeah, because understanding their part of what's going on for them is one piece of it. Understanding us is the other piece. And I think that's the part I find that can be tricky for a lot of adults to embrace. And not just parents, professionals working with kids, right? Yes. Teachers working with kids, healthcare professional, like we have to be willing to be aware of and understand our part of it. And that can be a hard sell, I think.
It's very hard. And I think for the people that are kind of on this conscious interaction path, or they're practicing consciousness in their daily life, I think a lot more feelings of shame and guilt can come up because we're more aware. Yeah. We're more aware of our, mistakes that we're making. We're more aware of the impacts that we might be having in these interactions with our children. Mm-hmm. So I think it's really important to go gradually and kind of titrate, our experience with triggers and be, compassionate with ourselves.
Yeah. For us and for them, right? Because trying to be aware of and change everything all at once is a recipe for disaster for our kids and for us.
Absolutely. Yes.
So I want to talk about, I want to bring occupational therapy into the conversation here, because it's one of the things that I think is really unique about you, and probably a lot of our listeners, maybe have had some interaction with occupational therapists over the course of maybe, their child's history, whether it's in school or outside therapy or whatever. But I think this idea of occupational therapists engaging in this type of work with parents, really this parent-focused piece, that's a shift for a lot of people, right? Because I think when they think about occupational therapy, it's like, oh, I bring my child to this clinic and the OT, does stuff in the sensory gym with my kid for 45 minutes. Or my idea of OT is my kid has it on their IEP and the OT comes in, once a week and works on handwriting or shoe tying or, whatever. And what you're combining here is really quite different. So I'd love to have you talk about the role of occupational therapists in doing this kind of work with parents.
Yes. So occupational therapy, we focus so much on function and occupation, engagement in our daily lives. And so, yes, in our sessions with parents, we are focusing on child-centered struggles, child-type issues, but our focus is really on the relationship. We're blending our knowledge in attachment science, in conscious interaction, in the way a child's brain develops, and also our knowledge of the sensory systems and making sense of behavior through the sensory system lens. So our sensory really is behavior. We can't detach one from the other. So, a great example of this is like this morning, I tripped and I hit my foot on the table. And then there was this immediate emotional reaction in me. There was this irritation. And so helping guide parents to understand the importance of the relationship, the importance of the sensory systems, making sense of our unique sensory experiences, us as parents and our children, is really the unique part of our work.
Mm-hmm. It's beautiful. And I think what's so profoundly important about this is the focus on parents as the primary driver of change here for kids. Particularly when they're having struggles, when they're having sensory issues, when they're having whatever, because I just know so many families where the child has been in occupational therapy for years and years and years, and the parent doesn't really know what's happening in those sessions, isn't receiving any guidance to do things at home. And I'm like, because I realized, 2 decades ago in starting to work with families and with kids, that actually most of my education and support better be geared towards parents, because they're the ones living in the trenches 24/7 with these kids. Like, me being able to do something with a kid in a session doesn't matter if I'm not supporting parents to understand and make those shifts. And so I think what you're talking about is so profoundly important. It's sort of the difference between like giving somebody a fish and teaching them to fish, right? And what you're really talking about here is teaching parents to fish, is teaching them how to understand what's going on in their child's brain and body and that connection, and then also what's going on in their brain and body so that they can support those daily interactions better, right?
Absolutely. Absolutely. The relationship is the foundation for everything else. So, we can work on the handwriting, we can work on the dressing, we can work on all of these things. But if the parent and child relationship is not strong, if there's, a break in that foundation, then everything else is going to crumble. Mm-hmm. So our focus is really on building that connection, building that relationship.
Mm-hmm. Yeah. So let's talk a bit about dysregulation in kids. Because all kids get dysregulated, right? Where, their emotional and behavioral reaction to the situation is maybe way out of the realm of what we expected or perceive as appropriate, right? That's dysregulation. All kids get dysregulated sometimes. Some kids get dysregulated way more often and way more intensely. So I'd love your perspective. How do you look at that in kids around how do you frame for yourself why dysregulation happens in kids? And then, we can get into maybe how we can use that to support them better. But how do you connect those dots for yourself?
Sure. So dysregulation can happen for a variety of reasons with our kids. We can never really know exactly what's going inside of them, but a few reasons would be, one would be the demands are greater than our child's capacity to cope. So, the situation at hand, their specific unique nervous system is not available to cope with that situation at hand. Another reason would be that, they're looking for connection, that attachment. And, a lot of times I think because I'm staying home with my kids, I'm with them all the time, they're fine. But a lot of times, if we haven't really gotten down at their level, if we haven't made eye contact, really connected with them, they're still going to be feeling dysregulated. Connection, that lack of connection with a caregiver is the greatest stressor for kids. Another reason would be, there's this physical and emotional buildup of energy that needs to be released, and it's coming out in dysregulation. Maybe it's, they're tired or hungry and they don't have the language yet to express that that's what's going on. And so it comes out in this funky behavior. So lots of different reasons. And sometimes they're just trying to affirm that their caregivers are safe and that they can go to their caregivers and they will show up the same way every time. So there's lots of reasons why our kids get dysregulated, unfortunately.
Yeah, and it's part of the developmental process, right? I think we forget that. I think that as adults, we sort of, our expectation for kids, whether we explicitly state it or not, our expectation is that they just do what they're supposed to do so that life goes more easily, right? And we forget that they are their brain is still developing. Of course they can't cope with and manage a lot of the things that we might expect them to because they're kids, right? And even through the teen years, they're kids, their brain is still developing, they're still growing, they're still learning. And so I think that, some of the time we run into chronic struggles with our kids because we're expecting this, and developmentally, this is where they are. And of course, there's going to be a gap. And there's going to be breakdowns. And then we don't tend to respond to that real well. It's like, well, why aren't you? Well, this is now making my life hard. Well, this is uncomfortable. You need to stop. And it's like, but wait a second, was our expectation reasonable in the first place?
Absolutely. And oftentimes us as adults can't even regulate our emotions.
Bingo.
So, we have these crazy expectations of our kids to be able to hold it together, and we can't even sometimes. So reminding myself of that too has been very powerful.
Right. It's so true. The classic example that comes to mind, both in my own life with my kids, but certainly with working with so many thousands of parents over the years, my kid will do something and I sort of snap and get triggered by it. And I start yelling and getting escalated. And when you step back from that, it's the irony of this, right? I'm upset with you, 5-year-old or 12-year-old or whatever, because you're not keeping it together and managing this. And also, what am I doing right now? Losing my what and blaming you for it, right? And I'm the adult in the situation. And I think when we can step back and realize, wow, does that happen a lot, right?
Yes, absolutely. Absolutely.
So I want to talk about this idea of meltdowns, because there's a lot on social media and elsewhere, like meltdowns and how to handle them, and there's a lot of different schools of thought on that. And so from this sort of relational nervous system regulation focused construct, how do you view a meltdown? What's happening there, and what should we be doing around that?
Yeah. So if you think about a meltdown, we're thinking about, how a child's brain develops, and our brain stem is what controls our survival. So this is where we're going to see these fight, flight, freeze responses show up in our kids. The brain develops from the bottom up. And so it takes thousands and thousands of these co-regulated interactions with us, the parents, before that part of the brain is even formed. So when our child is having a meltdown, their body and brain has scanned a threat in some way. So we think about, when we were in the tribe and there was this big grizzly bear, our first stress response is to fight. We want to try and fight the bear. And then if that doesn't work, then we try and run away from the bear. And if that doesn't work, we might try to play dead. So, when we talk about these stress responses in daily life, the stressors are different. The stressors are going to look different than back then. But that is essentially what a meltdown is. Our child's brain and body have scanned a threat in some way, and they are dysregulated.
Yeah. And I think what's important to point out here, as I'm sure you see all the time with the parents that you work with, it's not our perception of whether there's a threat, right? Because
Yes.
I don't know if you hear this a lot from parents, but like, well, there's no threat. Like, this was a minor thing. Of course they're safe, whatever. And it's like, no, but threat is in the eye of the beholder, right? This isn't about our perception as the adult. This is about the child's brain and body perception.
Absolutely. And, I think I've had a lot of practice at this because I have highly sensitive children. And so they have very unique nervous systems, very sensitive nervous systems. And so oftentimes I have to catch myself before I say, oh, come on, it's just a t-shirt, it's not a big deal, and really stop and think about what this experience is for her nervous system, how this is irritating in some way on her body. And it's her experience. And so really validating that for her and understanding that everybody has, everybody's nervous system is as unique as a thumbprint. And so we really need to make sure that we're accepting that and validating through that.
That's right. I love that you gave that example, because I think there's so many listeners going, that happens on a regular basis.
Yeah.
And so what are some other ways that shows up, just to help listeners sort of make this concrete in their mind, like maybe with your own kids that you notice, or with families that you work with, where we as the adult tend to not understand or misperceive. So the whole thing, like getting dressed or the clothing, that's one thing. Are there other ones that come to mind?
Yeah, I think we have so many expectations of what should happen. Like a lot of times we get into these, our own fear comes up, our own anger around things that we have expectations about. So, we might have some grief, like, for instance, with the t-shirt and the tag, like my daughter wears the same things and the same types of clothes. And I think there's some maybe grief around expectations around what I thought it would be like, right? What I thought my relationship or what my child would be like. I had these expectations of maybe this easygoing child, or this, this kid who would wear whatever I wanted them to wear, these cute outfits that I had planned, and she is very much, this unique person who has her own preferences. And so I think I run into this daily with my kids because, I have to really step away and notice what expectations I'm placing on my kids that are really not fair.
Yeah. And I think from a sensory systems standpoint, this is really tough for a lot of adults. If we don't experience some of these sensory processing issues, or just having a sensitive, system, not being able to process sensory information very well. If we don't have that issue, it's really tough. It takes some work, I think, for us to understand what that's like for our child so that we can take that perspective and respond in a way that represents understanding of that, right? And I would think that you
Yes.
probably see that a lot, especially with parents seeking out occupational therapy. Their kids have sensory issues. I would expect that probably a lot of what you do is helping them understand their child's experience of those things.
Absolutely. And also, I think what's even more powerful is helping them understand their own sensory system, because
Yeah.
then we're able to really apply it to somebody else. These
Yes.
are my unique sensory needs. I think in motherhood, there's this just overwhelming amount of overstimulation, bombardment through all the senses.
Yep.
So when we can really sit down with parents and kind of help them understand their own sensory systems, this actually helps them understand their kids and what's going on with their kids' sensory systems and how to best support them.
I'd love for you to give a couple examples, either for yourself or from parents that you've worked with, in helping adults understand their own sensory needs. Because we even if those of you listening, if you've been through like occupational therapy or sensory focused therapies with your kids, the focus has probably been on your kids, like, oh, the tags in the shirt, or needing to swing a lot, or wanting to crash into things. But I think not very often do we think about this for ourselves. So could you share some examples that you've come across of things that adults have become aware of or can relate to in terms of their own sensory experience?
Yes. So for me, I'm a highly sensitive parent. And so I have very unique sensitivities when it comes to like visual clutter, like seeing all the toys strewn about. I'm also very sensitive to auditory information. So when there's a lot of screaming, which is a very developmentally appropriate
Yep.
kid thing, when there's a lot of, kids climbing all over me, I get very, very overstimulated. And I think that this is normal for mothers in general, but when you have this sensitive nervous system, it's like that overstimulation times 10. And so what's been so helpful for me is making sure that I'm making like regular deposits into my own, for my own nervous system. So for me, this looks like getting outside, moving my body, identifying those times of the day that are more loud and popping in my earplugs so that I have a little bit of sensory deprivation. Maybe I'm noticing that I'm getting really overwhelmed and overstimulated, and I need to take a break in my room for 5 minutes so that I can catch a breath and come back to center. So all of these things have helped me understand my own nervous system, and then I can use those tools throughout my day.
It's so interesting talking about this because it's making me remember there was a post that I did on social media. I don't know, probably 2 months ago now, but it was around this issue of how do you support your own sensory needs when your kids are loud and whatever. And that was like one of my most popular posts by far. And it surprised me. In hindsight, it doesn't surprise me. And now in talking with you about it, it doesn't surprise me. At the time, I was like, oh, wow. But that's so true, right? Our experience as moms, especially when you've got a lot of younger kids, or, if you are a person who really values space and privacy and quiet, like, wow, does that collide with parenting in a big way? Or even like teens who can be, loud and all over the place. Or certainly if you have a child who's very easily dysregulated for whatever reason, there's a lot of noise, there's a lot of just stuff. And I think often we talk about like self-care, needing to take time for ourselves, get away, like from the standpoint of like the psychological part of us. And actually, I think what we're really talking about there is exactly what you're saying. Like, no, this is at a very base foundational level about understanding and supporting our own sensory needs, our own nervous system regulation, and managing sensation around that.
Yes, absolutely. And, when we're doing that, we can say out loud what we're doing, and we're modeling how to take care of our own nervous systems and showing our kids how to do the same. And I think in motherhood, it's so, sometimes I'm able to regulate, sometimes I'm able to make those deposits into my sensory bank. And sometimes I'm not. Sometimes the wrath of 4 small children, just completely overtakes my ability to cope with the situation. And in those instances, what's been so helpful for me is channeling that my own like rage or dysregulation that comes up from that overstimulation into helpful energy.
Yeah.
So energy that's not going to harm my kids, it's not going to make them feel bad, but it allows me to get that release. And it shifts the energy into this playful tone. So, one post that Katie and I did recently was this monster mommy. So we channel that rage, we channel that angst, and we stomp around and chase the kids and be this monster. So we're able to get that out, and our kids are not scared by our reaction.
Right. Yeah. I love that. I'd love for you to share some more examples of ways that you, when you're working with parents, help them to apply this stuff. So you talked about some things that you do for yourself as far as like earplugs, getting time away. What are some other sort of go-to things when you're first starting to work with parents around this, that you try to have them maybe do on a regular basis with their kids, or, embed into certain activities, or like, what are some of the things that are helpful starting points?
Yeah. So one of the things that we always talk about too are just how to support in those moments. Let's take a meltdown. So as an OT, I'm thinking about ways that we can support that child's unique nervous system through either adding sensory input or taking it away.
Yep.
So maybe this looks like, doing some, if we're trying to get some energy out, we're going to crash on the couch, or we're going to do 5 big jumps, get that energy out. Sometimes it's taking away sensory input. So sometimes it's like, okay, we need to come over here where there's less, visual stimuli. Maybe it's sitting in a hammock. So we have that kind of sensory deprivation. Maybe it's an environmental shift. Maybe we're out at a party and our child's melting down, and what we need to do is kind of bring them into another room away from the crowd. Maybe the people are overstimulating. It's a new environment, and we read a book for a minute, and then we can kind of regroup and go back out. So a lot of it is kind of helping parents to understand their child's specific needs and what can help in those moments day to day.
Yeah, I love that. I want to go back to the example that you gave, because I think it's such a common one, of your experience with your daughter around getting dressed and around clothing. Because I know for most people listening, and my experience with most parents over the years, that type of thing can lead to a daily chronic power struggle, battle. The kid's triggered, we're triggered, every day starts terribly. So I'd love to have you sort of tangibly walk through either how you have shifted to thinking about and managing that. Maybe there's some proactive things, maybe there's some things in the moment. How can we shift though, if a parent is really in that chronic power struggle cycle with their kid over what they're going to wear, or maybe it's what they're going to eat, or, when they're going to put their socks on or whatever. What are your recommendations around that?
Yeah. So, in all of our sessions with parents, we're starting with regulating the parents first. We're starting with talking about what's coming up for them around this specific child struggle. So, with the tags, with getting dressed, is there anger? Is there fear? Is there some sort of expectation there? Maybe some sadness and grief, and regulating through that, making sense of that with the parent. And then once we've kind of regulated around the parent's emotions, figuring out what is it? What's at the root of this behavior? What's the underlying need or emotion? And sometimes it's as simple as they don't like the way, their tactile system is sensitive, and they don't like the way that the tag feels on their body. And so for me, I've really taken this approach of, I'm going to respect that this is not something that my child likes. This is something that's an easy, solution. We cut out the tags for her shirt. We buy the types of clothes that she likes. And we kind of accommodate that way.
I think it's interesting because this happens without us realizing it, even in something as seemingly insignificant as what our kid wants to wear or, can't tolerate wearing. We do this mental time travel without even being aware of it, of that my daughter not wanting to put these clothes on. I think you're right. Can trigger embarrassment for some people. What will other people think of me? Which often is rooted in our own experience as children of having to do things because our parents didn't want to be embarrassed of us, right? Not that that was explicitly stated, but that was the deal, right? So sometimes there's embarrassment, shame, those kinds of things. But I think also we jump to, without even realizing it, oh my gosh, like what's going to happen to my kid if they don't learn to do things they don't want to do? Like they're never going to make it through school. They won't get into a good college. She's never going to have a job. Like, and
Yes.
we are reacting to this situation over tags in the shirt out of a space of, oh my gosh, you're going to be homeless and never be able to work.
Yes. We're usually operating from the past or the present.
Yeah.
And we're never, we really need to slow down and focus on the present moment.
That's right.
Yes,
that's right. Yeah. We're in the past, we're in the future. And what we need to be is like right here, right now. Yeah.
Yes.
Yeah. Yeah. I think that's so true. I just want to touch on, because I think this is part of your story, the piece about trauma. Trauma can be defined lots of different ways. Our listeners know we've done several different episodes on trauma in various ways, but I'm curious for you as a mom, as an occupational therapist, as an adoptee, doing the kind of work you're doing now, how do you think about the role of trauma for us in our parenting?
Yeah, so I think there's so many definitions of trauma, but one that I have kind of attached to is just anything that has kind of overwhelmed our nervous system and our ability to cope in the moment. And so many times I think we think of these as trauma as these big events that happen, like a car accident. And yes, those are traumatic events, but there's also these little traumas that happen, developmental trauma, attachment trauma, things that we didn't get, emotional neglect. So when we think about, the kind of parenting style that our own parents had, was there permissiveness where emotions ran the show? Was there this authoritarian where, force and control and obedience and compliance was prioritized over the relationship? All of these things, get wired into us and then directly impact our ability and our parenting today. And it's not until we become aware of that and our own patterns that we can make a change.
And we tend to just repeat these patterns, right? Unless we become consciously aware of them.
Absolutely. Yes. And if we had a caregiver who, was emotionally dysregulated or didn't know how to regulate their own emotions, that is going to impact our ability to help co-regulate our child's emotions. It's going to be very difficult to make space for those big feelings that come up.
Before we wrap up, I have one more question I want to ask. This is occurring to me because, many of the parents who listen to this show have children who have been diagnosed with something, right? Who have symptoms, issues that rise to the level of maybe they've been diagnosed as autistic or, with ADHD or a learning disability or anxiety, depression, whatever it might be. And I think that one of the unfortunate things that happens around this whole way of understanding the parent-child relationship, like, trauma informed and also nervous system regulation and looking at our own issues and whatever. I think that a lot of parents, if their kid has a clinical diagnosis of something, look at that and go, well, that's nice for the rest of you, but that doesn't apply to me. Like me doing this work, me operating in this way, that's like, that doesn't address my child's autism, right? Or, well, you don't understand. My kid has been diagnosed with like 7 behavioral disorders, neurodevelopmental issues, whatever. Like this isn't part of the picture for us. Like that's nice for the rest of you, but this isn't for us. This can't make a difference for us. And I'm curious your response to that.
Yeah, I think that relationship with the caregiver is always at the foundation of everything, diagnosis or not. You know, if we have that safe, nurturing caregiver that we can turn to in any of those hard moments, whether we're neurotypical or neurodivergent or whatever it might be, that is of utmost importance, I would say. So yeah.
It becomes almost more important in those situations, I think.
Yes.
Which is ironic, right? The people who are most like, well, no, I need to do all these behavioral programs or all these other things. Like, this isn't for me. I'm like, no, it's actually even more important for you because your child already has such a more sensitive nervous system and brain body disconnect. Like, it's even more important.
Yes, absolutely. And I think, you know, with all, you know, the parenting advice that's out there and all of these different platforms, it's easy to get kind of taken away by all of these, like, well, I should be doing this and I should be doing that. And I think it's really important to focus on the child that's in front of you and to really focus on what their specific needs are, because we can't take blanket advice. Every person is unique. Every nervous system is unique. And so some advice might not work for somebody, and it might work for somebody else.
Right. Right. Oh, I love that. This has been so many more things we could talk about, but I know we need to wrap up, and I want to make sure that you have an opportunity to tell people where they can find out more about you, your work, what you're doing.
Yes. So I work with Katie Crosby over at Thriving Littles. You can find us at www.thrivinglittles.com, and you can find me at The Empowered Family on Instagram.
And Maggie's Instagram is so great. You do a lot of just honest from your heart posts and also informative and educational. So I highly recommend that you all go over to Instagram if you're on there and follow Maggie. And you just recently changed the name of your account, right? It's at The Empowered Family.
Yes.
Yeah, awesome. I love that. And say a little bit about Thriving Littles, because you all have a virtual clinic, right?
Yes.
Okay.
So we see clients one-on-one virtually, and we also have programs and courses as well.
Awesome. Awesome. Maggie, thank you so much for the wonderful work you are doing in the world as a mom, as an occupational therapist, as an educator, and parent coach. Like, just really so value what you're doing. And also thank you for sharing time with us today. We appreciate it.
Absolutely. Thank you so much.
And thanks as always to all of you for being here and for listening. We'll catch you back here next time.